Every day, the opioid crisis claims lives and tears families apart. Let's unite now to turn the tide and rebuild our future, ending the opioid crisis. What is it? Opioids are a type of chemical that interact with chemical receptors in the brain and body to reduce pain. An opioid addiction describes using and abusing these drugs to reproduce a feeling of euphoria despite the negative consequences. Who does it impact? Opioid addictions have the power to impact anyone with access to prescription medication. People under treatment for acute pain, like recovering from an injury or surgery, cancer, and end-of-life care, are also at risk. Some important statistics include, by June 2021, synthetic opioids were involved in an estimated 87% of opioid deaths and 65% of all drug overdose deaths. According to the AMA, roughly 3% to 19% of people who take prescription pain medications develop an addiction to them. About 45% of people who use heroin started with an addiction to prescription opioids. Making a change. What has been done? Equipping states with resources, improving data collection, and supporting the use of evidence-based strategies. For example, Overdose Data to Action provides funding to health departments to reduce drug overdoses. Supporting healthcare systems and providers to improve opioid prescribing and patient safety. Partnering with public safety officials and community organizations, as well as monitoring trends to understand and respond better. But what's still missing? More education and awareness in the communities at risk, enhance access to treatment for people suffering from addiction, expansion of harm reduction programs, those to provide clean needles, safe spaces, and naloxone, which is an overdose reversal medication, as well as a focus on addiction prevention, advocating for alternative pain management options and strategies to prevent misuse. What can we do in our daily lives to reduce this crisis? We can practice safe medicine use, educate ourselves and others, challenge the stigma and support those who are struggling, participate in local community efforts, and support recovery programs and research. Together, we can end this crisis in our communities and in the world.